Hi everybody, welcome to today's video. We are going to be discussing suicide prevention in older adults. My professional background is in crisis intervention, and I'll be providing you tools, resources, and information about suicide prevention. So what we're going to be going over today, we're going to discuss the myths versus facts of suicide, statistics, signs, support and prevention, and resources. The first section is myths versus facts. The first myth is that talking about suicide increases the chance that a person will act on it. That's simply not true. Discussing suicide can decrease suicidal thoughts, improve mental health outcomes, and increase the likelihood of somebody seeking treatment. It's important to have conversations with those in crisis or going through depression about suicide. So that way those thoughts don't become overwhelming, internalized things that end up taking over. Having conversations about suicide is important for suicide prevention. The next myth is that older people who talk about suicide are just seeking attention. If somebody is talking about suicide, chances are that this is a serious thing that's happening for them. It's crucial to take anyone expressing suicidal thoughts seriously. Ask them questions about what their intentions are and approach that conversation with kindness and sensitivity. The next myth is that teenagers and college students are the most at risk for suicide. What is actually the case is that the highest rate of suicide is amongst men and women from the ages of 45 to 64. In a few slides, we'll get some more specific data on what those suicide risks are per age group. The next one is that barriers to reduce access to lethal methods of suicide doesn't work. Limiting access to lethal means like firearms or large stocks of medication is an effective strategy for reducing suicide chances. Many attempts are impulsive decisions, and separation from means gives them time to reconsider. Suicide can't be prevented. Suicide can be prevented. And while it is preventable, it is unpredictable and often stems from intense emotional pain, hopelessness, and negative life views. And these things are influenced by genetics, mental health issues, and environmental factors. Suicide always occurs without warning. There are almost always warning signs before a suicide attempt. We will also be going over them in this presentation. People who take their own lives are selfish, cowards, or weak. People do not choose to die by suicide. It's often the result of significant emotional pain, difficulty seeing alternatives, and complex factors such as psychiatric illnesses and substance use. And the last myth is that talk therapy and medications don't work. Treatment is effective in preventing suicide, and getting help from mental illnesses or substance abuse, along with learning coping strategies, can significantly reduce the risk of somebody attempting to take their life, although it may take some time to find the right treatment. Now we're moving on to some of the statistics behind suicide. So these graphs show the death by suicide rates in the United States. The top graph shows you the male versus female overall rates across age groups. Males are more likely to die by suicide. They often turn to more lethal means of attempting suicide, such as the use of firearms, whereas women often turn to less lethal means of suicide attempts, and that's why their rate of death by suicide is significantly lower. On the bottom, you'll see the female and male statistics of death by suicide. You'll see that for women, the highest rate of death by suicide is in the age groups of 45 to 64. The third highest is 65 to 74, and the second to last highest is 75 and over. And you'll notice that on these trends in recent years, they are moving in an upward direction. On the male side of things, the ages of 75 and over have the highest death by suicide rate. The next highest being ages 45 to 64. And lastly, having ages 65 through 74, they appear to be the fourth one down. Similarly to the female statistics, there does seem to be a rise in the death by suicide trend for men in the 75 and over and 65 to 74, with a slight decrease in 45 to 64. These next two graphs show the suicide rates in older adults. As you can see on the men versus women for the older adults death by suicide graph, the highest rate is 85 and older for men, significantly high in 75 to 84. And you'll see heightened trends in the 55 to 64 and 65 to 74. You'll also notice that the highest rate for women is slightly different, that being in the 55 to 64 age range and slowly decreasing as age increases, but still a predominantly significant issue in older adults across the board. Recent trends, so this graph shows how the suicide rate by age group has changed in the United States between 2021 and 2022. Luckily and phenomenally, there's been an 18% decrease from the ages of 10 to 14, a 9% decrease from 15 to 24, and a 2% decrease for 25 to 34. A significant factor of that is the availability of mental health services for younger people. Although what you will see as we transition to the side of the older adults, 35 to 44-year-olds experience a 3% increase, 45 to 54, a 5% increase, 55 to 64 is a 9% increase over the span of a year, 65 to 74 up 3%, and 75 and older is up 5%. So now that we know kind of the statistics and the research behind suicidality, it's also important to know the signs of suicide. Earlier we talked about how there are almost always warning signs. It's important to have that information so you know what to look out for in yourself and your loved ones. Some of the risk factors for older adults in particular include unaddressed mental illness, social isolation, illness or disability, access to lethal means, major life changes or stressful events, substance abuse, lack of access to mental health care, and previous suicide attempts or a family history of suicide. Some of the signs of suicide in older adults include depression, hopelessness, ignoring doctor's orders, so not taking medication as prescribed, not following your health plan with your doctor, increased substance use or abuse, no sense of purpose, and feeling trapped. Also, changes in sleep, saying goodbye to friends and family, loved ones, getting affairs in order, failure to care for oneself, meeting one's basic needs, giving away possessions, and talking about being a burden. Preoccupation with death, withdrawal from friends, family, and activities that were previously enjoyable, looking for means to self-harm, talking about wanting to die, or suicide. Uncontrolled anger, sudden mood changes, and on the topic of sudden mood changes, what this can sometimes look like is somebody who has been depressed and helpless for a long time, all of a sudden you notice that they're really happy, that they're smiling more, they seem more at peace very suddenly, and they're also doing things such as giving gifts. This is a warning sign that something may not be right, especially if somebody has been in a depressed state for so long. Unfortunately, sometimes this does look like improvement in mental health symptoms, but oftentimes that does indicate that a person has made a choice that they are going to end their life by suicide soon. This also includes anxiety and agitation. Some of the critical signs to look out for is somebody talking about feeling hopeless and having no reason to live, seeking out methods of self-harm. This can look like researching how to buy a firearm, acquiring a large stock of medication. If they're prescribed something by a doctor, they may not be taking it and may just be holding on to it, kind of hoarding medication. Also, regularly talking about death or suicide. These are critical signs to look out for. So for support and prevention, there are different ways to go about this. We're going to kind of go over what that looks like. So if this is something that you find yourself going through currently, you're, feeling hopeless, depressed, you're having suicidal thoughts, it's important that you recognize those feelings and talk to somebody, a friend, family member, a colleague that you feel comfortable with, a caretaker, anybody in your circle that you can turn to with these thoughts, and seeking out professional help. This can look like a therapist, a social worker, a psychologist, psychiatrist, or even your medical provider. They oftentimes do risk assessments when you go to the doctor, and it is a great time to use that opportunity to come forward with what you're struggling with to get resources and recommendations for help. It's also important to create a safety plan. We'll go over what that looks like more specifically, but come up with a way to keep yourself safe with the support of a friend or professional. Limiting access to lethal means, so limiting access to things like firearms, large stocks of medication, or any other ways that you have thought about ending your life. Staying connected with others and engaging in self-care, making sure that you're talking with your friends, with your family, with those that are close to you, and engaging in activities to take care of yourself, whether that's doing something nice for yourself or making sure that you are eating and drinking water. Following up on treatment, following up with your mental health provider, following up with resources that you are given by your medical doctor, any treatment that you have started, continue following up on that. And also educate yourself. Make sure that you're paying attention to, how do I know I'm going to experience a crisis? How do I know that suicidal thoughts are coming? What do I recognize about myself? Is it something major happens that negatively impacts me and I start having these thoughts? Recognizing triggers. Is it I start feeling depressed for a few days and I notice these thoughts come on? It's important to make yourself aware of what comes before the suicidal thoughts. And if you feel that you are in immediate danger of harming yourself and that you do not have time to seek out treatment, please go to the nearest emergency room or call 911. There's also the 988 Suicide and Crisis Lifeline that can support you as well. You can reach out to them through phone call, text, or online. So in the prior slide, we talked about creating a safety plan, and this is kind of what this looks like. So the safety plan on this is the one that was created by 988, and it goes over the following things. So knowing the warning signs, going back to that topic of educating yourself. Thoughts, images, moods, situations, and behaviors that let you know that a crisis might be developing. Also, coping strategies. What can you do to take your mind off of your problems on your own before reaching out to another person? Do you have a relaxation technique? Do you have an activity that you enjoy doing? Can you exercise? What are some things that you can do to distract yourself from those thoughts? Also, people and social settings that provide distraction. Who can you go hang out with? Who can you go spend time with? Where can you go? Is there a senior social going on? I know that Amador County does have some senior fitness groups. Any social events going on to take you out of your isolated space and away from the suicidal thoughts. And also people you are comfortable turning to for help. Is that a very close friend? Is that a family member? Is that a care worker? Is that somebody in your circle that you trust? Make sure that you have them listed and their phone number, because you're going to want to reference this in the event of a crisis. Professionals or agencies that I can contact during a crisis. This can include your therapist, social worker, psychologist, whoever your mental health professional is. Local mental health agencies such as Amador County Behavioral Health, they do have a crisis line. Also making sure that you're aware of where is the closest urgent care to me, where is the closest emergency room to me. Write that down. And making the environment safe. What do you need to remove from your environment so that you do not use that as a method of trying to harm or kill yourself? And one thing that 988 does a great job of on the safety plan is including that line about the one thing that is most important to me and worth living for. Whether this is a child, a sibling, even a pet, or you have to water your plants to keep them alive. Anything that you have that provides you responsibility for that thing's emotions and well-being, include that on your safety plan. Include a reminder of what you are living for and what you are fighting to survive for. Now, how do you help somebody that you know? If you're not the one going through suicidal thoughts, but somebody you know is, or you're worried about somebody you know, it's important to know the warning signs. You can reference back a few slides back when we discussed what those signs are. Listen and be present. Listen more than you talk. Be present. Be there for them physically. Express that you're concerned. It's okay to share with them that you care about them and that you're worried. And support safety measures. So if they are creating a safety plan and in that plan they have to remove items from their home, you could be the person that holds on to them until it is safe to return that to that person. Staying connected with them. Check in on your friends, check in on your loved ones, see how they're doing, and try to help them as much as you are able to. And approach them without judgment. The last thing a person in a crisis needs is to feel judged by the people that are closest to them. Also offer practical support. When somebody is in this state, it is extremely difficult to manage basic tasks like cooking, cleaning, managing chores, anything like that. Try to offer them support in ways that helps keep their environment a comfortable place to be in. Encourage healthy activities. If your friend tells you, I'm going to go to a senior workout class, encourage that. Offer to go with them if you're able to. If they say, I'm going to start going to therapy, provide them encouragement for that too. Also, please utilize emergency services or crisis support lines if necessary. While it may feel like you are betraying that person's trust in the moment, what is more important is that they are kept safe. And so if they are in immediate harm, please take them to the emergency room, call 911. And also, take care of yourself through this. It is a heavy thing to support somebody going through a suicidal or mental health crisis. Make sure that you also have supports in place and that you are doing what you need to take care of yourself. We cannot give what we do not have. And when it comes to having the conversation with them about suicide, be calm and be direct. Talk about suicide specifically and ask direct questions about their intentions. Express that you care for them and you're concerned for their well-being. And create a safe environment, an environment that's non-confrontational, an environment that is welcoming, an environment that is comfortable. And be prepared with resources for them, as well as their response to your question of, are you thinking about suicide? Whether that be yes or no. And try to have a non-judgmental reaction to that as much as possible. And listen more than you talk. They have so much going on, and while in the moment it might seem like I could share all of this stuff with them, I can talk them out of it, just listen. That is the most helpful thing that you can do. And make sure that you have your own supports in place. Again, taking care of yourself as you are supporting somebody in a crisis. And this is a list of what not to say. When you're trying to support somebody through a crisis, it matters what you say and making sure that it is helpful. The first one, you're not thinking about suicide, are you? Or you're not going to do something stupid, right? Don't ask in a way that indicates that you want no for an answer, because that will make them less likely to be honest with you about what they're going through. Fine. If you want to be selfish and kill yourself, then go right ahead. See if I care. Do not tell a person to do it. You may be frustrated, you may be angry, you may want to shout at them, but saying this is the most dangerous thing. You do not want to encourage them to act on their suicidal plan. Don't worry, I won't tell anyone. Your secret is safe with me. Secrets do not coincide with safety. Say this instead. I care about you too much to keep a secret like this. You need help, and I am here to help you get it. They may feel betrayed in the moment. They may feel like they shouldn't have opened up to you, but their safety is more important than their secrets. And we have some resources in the community for those who are currently struggling with mental health or suicidal thoughts. Again, I want to draw your attention to 988. In the midst of a crisis, this is a great resource. Also, to learn more information about signs and suicide prevention, you can go to www.suicidispreventable.org. And on this list of resources, we have Amador County Behavioral Health for ongoing mental health treatment, Nexus Youth and Family Services. We do offer connection to resources as well as different services in the community, the Institute on Aging Friendship Line, NAMI Amador, the Amador County Local Crisis Line. This is run by Amador County Behavioral Health. It is a 24-hour line. Suicide Prevention and Crisis Services through WellSpace Health, Sierra Wind Wellness and Recovery Center, and Victory Village Veterans Support. We also have some additional resources. So there is the Safety Plan app, which was developed by the United States Department of Veteran Affairs. It is a mobile safety plan, as well as the Virtual Hope Box. This was created by the Department of Defense in collaboration with the Department of Veteran Affairs, and it has effective coping skills. If you need help on learning new coping skills and finding ones that work for you, this is a great resource. Both of these QR codes go to links to download them either from the Apple iTunes Store or the Google Play Store. We also have a QR code here for a survey on the presentation. Please give us your feedback, whether you liked it, didn't like it, have feedback for improvements, anything you want to share with us. You can scan this code and we will receive your feedback and take it into consideration for improving these presentations and wellness workshops. And that is the end of today's video. Thank you so much for watching. If this video applies to you or somebody you know, please don't forget to like, comment, share, and subscribe. And please look out for future videos. We do a wellness workshop presentation every month. Thank you.